The next question a patient must ask their doctor before having dental implant surgery is whether the entire implant procedure will be performed by that doctor, or whether the doctor will do the implant surgery and then somebody else will do the implant restoration. I've always been a firm believer in the team approach. I learned that in the Boy Scouts. As a team, we can accomplish more. As a volunteer firefighter, I know for sure we're a whole lot more effective putting out a fire than one guy running to the scene of the fire with his hose. Why is that? Because each firefighter brings his unique experience and efforts to fighting that fire. I believe the same is true in dental implant surgery. When you have a team approach of a surgeon, such as myself, and a restorative dentist, each person has their area of expertise, and together I believe that expertise far exceeds what any one person can have themselves. And many times that can result in a better outcome for the patient. Also, let's take the team approach in firefighting. If I go into the fire by myself and there's a problem, who's backing me up? There's nobody else there. With the team approach in implant dentistry, the surgeon and the restorative dentist acts as checks and balances for each other. We bounce ideas off each other. We check each other's work. He's checking mine, I'm checking his. What does that do? When you know someone's checking, everybody raises to the highest level possible. Now, many patients are sometimes discouraged to learn that they have the implant done in one office and the restoration done in another office. And they feel this way because they think it's going to be confusing. It's going to be a needless hassle. How will I know where to go? What will I tell that person? How will it be coordinated? It seems like it's a lot of confusion. Nothing could be further from the truth. Many of our patients come to our office and they don't have a restorative dentist. First, we refer them to a dentist who I know is a top-notch dentist, who I've worked with many, many times, and who I know can do an excellent job on their implant restoration. So the patient doesn't have to worry, will I find a good dentist on my own? Second, that dentist and I work together to plan their case, and we give that patient a written sheet so they know what every visit is going to be and where that visit is going to take place, how long it's going to be between visits, and what the total fee is going to be. So there's no confusion, the patient isn't lost in the middle. We've developed systems which are airtight so that the patient doesn't get lost, as we call it, and that the case goes as smoothly as if it were done in one office. We like to think of it as a virtual office. Two doctors almost operating within the same practice in two facilities. I urge you to call my office to schedule an appointment for a consultation. We can discuss how implants can help you achieve your oral health goals so you can smile better, feel better, and enjoy life more.